Can you give me an update on where things stand right now with the vaccine?
The adult trial is just about completed, and the adolescent trial is in its last months.
So, are you looking now for final approval from the FDA?
The company will apply for licensure, which is the same as a final approval. And they'll continue to do research to make sure that the strains in the vaccine meet the changing epidemiology of COVID, as is the case for all of the COVID vaccines.
Did this particular virus present any unique challenges?
This was a pandemic. And so we were charged with getting a vaccine from the bench to understand whether it's safe and effective in people in a very short period of time because of the high severity of disease and mortality. The Novavax vaccine manufacturer is a little bit more traditional, so took a little bit longer, but still, we were working in record time. And at our site, we enrolled 500 volunteers into the study, and we don't normally do studies with that many volunteers. And there were so many partners that were working together to ensure that this was done correctly and safely and thoughtfully, and that all of the normal regulatory steps were followed. And so it was a very, very intensive process.
What are some of the differences between the Novavax and the mRNA? Can you shed some more light on that?
Yes. So the mRNA vaccine technology is a new technology. And in this day and age, it's actually an extremely easy and efficient technology. And so what the researchers did was they took the messenger RNA code to make the spike protein of coronavirus. And then our cells read that messenger RNA message and made the spike protein. And then the messenger RNA was degraded over time and gone. And what was left was this spike protein. So the way that the Novavax vaccine works is that we actually give people the spike protein itself in a kind of little particle that has something around it like an adjuvant, like a lipid particle to strengthen our immune response. Spike protein is really the major component of all of the existing COVID vaccines that have been licensed. Those little spikes that come off of the virus are how the virus attaches to our cells. And so if you have antibodies because of the vaccine, it can coat those spikes and they can't attach to our cells. So that's how the spike proteins give us immunity.